Says Ebola is now a top national security priority. It's prompting President Obama to make a big decision.
He's set to unveil a new strategy today when he visits the Centers for Disease Control headquarters in Atlanta. Now, one of President Obama's main components of the strategy is to send up to 3,000 U.S. military members to West Africa. Medical personnel could also be sent to help train doctors. There is a concern that the international community hasn't sent enough resources to battle the disease.
That new plan means military members from southern Colorado could be sent to West Africa to face the deadly epidemic.
It would take about 2 weeks to get the 3,000 U.S. forces there, according to White House officials. That is double the amount of U.S. soldiers currently serving in Iraq for the ISIS threat. KRDO News Channel 13's Bonnie Silkman has more on the strategy and found out what you think about it. She brings us the story new at noon.
Hugs and tears at Fort Carson this morning. After 6 months, more than 100 soldiers came home from Afghanistan.
It's just the greatest feeling in the world to be able to come back from a deployment and just get to be back with the family.
But Fort Carson soldiers and troops across the country could be packing up again soon, this time to West Africa. The Obama administration is ramping up its response, preparing to send 3,000 U.S. soldiers to West Africa for medical and logistical support.
I don't know that this is our fight to fight. We fight everything in every country, and we have so many things that are going on now in this country. Children that don't have enough to eat, seniors that don't have the care that they need to get.
We spoke with Mark LeBlanc, an Army veteran with a son training to be an Army medic.
Not this time, but next time it could be him over there as a doctor with his hands on those patients. So yeah, I'm concerned.
Concerned for good reason. Ebola has killed nearly 2,500 people in West Africa.
Even more concerning is those poor troops that maybe don't have the medical training, that they're the kind of guard and all that. They've been through so much already.
Soldiers who've been through so much may be getting ready to fight a new and different enemy. In Colorado Springs, Bonnie Silkman, KRDO News Channel 13.
And the U.S. also hopes to train healthcare workers as many as 500 per week to help deal with the outbreak. Ebola is spread through direct contact with the bodily fluids of sick patients, making doctors and nurses especially vulnerable. Well, that brings us to